die, right? And most likely, we're going to give the person what? Okay? Now, there's a whole bunch of stuff that we need to cover. So yesterday I posted, I know my email there. This morning I realized there were 2 things in there that were missing and 2 things that were added there twice. So, natural immunity, what does it have to do with? What the body has, right? And one of the things that we have is the inflammation response, right? So somebody, let's say I hit myself to the side, let's say it's in here, I may get a little bit of redness, I may get a little inflammation. So the inflammation comes because there's more blood that rushes to that area, right? The body's trying to prevent something from happening. We already talked about white blood cells, and then we talked about acquired immunity. So acquired immunity is what? It comes from the outside. So HIV comes from the outside. Even when it's transmitted from the mother to the child, it's still considered from the outside. Okay? Because the mother got the HIV from external factors, and then the mother to the child. If it was other things like, what is passed from the mother to the child? Well, outside HIV. Does the mother pass to the child certain type of immunity?
Yes.
Through either breast milk? What immunity that would be? Correct. So any of the vaccines that most likely the mother has is going to be transmitted to the child. That's not always happen. But most of them do get transmitted from the mother to the child. Then you have the active immunity. What's that?
So vaccines are not acquired, that's just mother to child.
So the mother to child will be what? Passive.
Okay,
We're going to go over all of them. So, but what's the question?
what is acquired immunity?
Acquired is external. So the HIV virus, right? You don't develop it yourself. Something has to come into the body.
That's not immunity, that's HIV. What is acquired immunity?
What's the first name on AIDS? Acquired. That's why I'm using that example.
So are you basically saying
Hold on a second, actually. Repeat that.
Yeah.
so
Are you
vaccines
sure?
are acquired?
Hmm?
Vaccines are acquired immunity or no?
No.
So that's passive?
Correct. Acquire has to be an infection.
So you get infected by something and then your body
Correct.
creates
So something
immunity.
external.
Okay. Okay.
Like the flu vaccine, I thought was acquired.
Isn't that active?
So, okay. Think about this. If acquired is an infection, it could not be a vaccine, right?
How many questions do you have on this exam?
If it's active, that's what? Is the body itself. Correct. If it's passive, it comes from the mother to the child. Except for HIV. HIV is acquired. Because HIV is not an infection. AIDS is the infection.
But you can't become immune to HIV.
You what?
How is that immunity when you can't, that's just a disease, right? You can't be immune to HIV. You can't grow immunity to HIV, right?
Well, you can't get it
Yes,
again.
you can.
You have it once, you can't get it again.
Yeah, and you can develop it. People, when I taught AIDS HIV, I was very specific that some people from certain backgrounds will never acquire HIV. They will have the disorder in their body, will never manifest and will never pass it to somebody else, especially people with great consent. No. What I said was, if the parents have it and they are, it's the mother, not the mother, the father has it, right? It's the mother. If the mother has it, and the mother is taking antiretroviral medication, 99.9% that the child will not have it. Will not acquire the infection through the mother.
Can you go over that?
What? Go over what? I'm sorry?
Natural and active, because it sounds like those are the same thing.
They're very similar. Where's natural? Natural is, the example that I'm giving you is the inflammatory response. That if something happens to the body, you hit yourself, there's inflammation because blood moves to that area to try to stop whatever is happening. Inside your body itself is doing it. Once again, acquired is from the outside. It's a disease that somebody gets. Active is also an immunity response that the body does that tries to kill organism, pathogen, whatever it is. Passive is passed from the mother to the child.
Would active, maybe like, would that also be like, mild, like, what's required, like, the SDR, like, space,
Yeah.
but like, so now you have
Okay?
So, active become acquired.
All right. So let's keep going. What's next? Does anybody know what T cells are? B cells? Which?
Components of the immune system found in the bone marrow.
Okay, one more time.
The components of the immune system that are found in the bone marrow.
Are T cells
So it's right here. What T cells are going to do are going to try to kill infected cells. Why did I use the word try? Because again, it doesn't always happen. It depends on the person that have allergies, their nutrition status, their immune system status, and then B cells are producing antibodies that are trying to neutralize and also kill pathogens.
I'm sorry, I don't feel make you repeat yourself. I'm just confused because I thought acquired immunity was through artificial immunity, such as like vaccines and stuff like that.
I think isn't acquired immunity like, and then there's two parts. So like passive and active are part of acquired. If those are the two types that you can have of acquired, aren't they like subparts?
I've been using the example of acquired for AIDS because that's what you need to know. Okay? Sometimes less is more. Acquired, once again, has to do with what? A disorder that you get from the outside.
Can I just go over your examples that you gave, right, for this lecture on the immunity? So I have it correct.
Go ahead.
Okay, natural immunity is what the body has as an immune response. So the inflammation response.
Stop right there. So natural, think about that. Nobody's creating that. Nobody from the outside. It comes from within you.
Okay. And acquired means like a disease process, like AIDS, or you're infected externally. Okay. And then passive would be mother to child, like you get breast milk, or whatever mom has immunity to that she passes. And then active immunity is your body tries to kill an infection, but it doesn't always happen.
Correct.
Okay.
So if your body's
Thank you, Juliana.
No problem. Go ahead.
Jeffrey, I think you had a question? Or you didn't?
I did, but got lost in the sauce. Okay, so T cells are more non-specific, and B cells, they attach to specific cells based on the surface body.
Well, they both can. But what all I need to do, guys, to know what I'm telling you, because this is not a biology class, this is not a microbiology course. This is it, that's it. For the test questions, what you need to know is what I'm telling you. You're 100% right. And I'm not trying to say anything negative to me. Just let's concentrate on this. Otherwise, you're going to be thinking about all these big pictures that really doesn't matter.
So if we,
Very fine today.
If we listen to the examples that you were giving, we are gonna do well on this part of the test.
There's 5 questions. And nothing that we have discussed is going to be on the test. No. But, okay, this is going to be very easy. Everybody needs to pay attention what I'm about to tell you.
Okay.
It's very, I'm going to go back to the PowerPoint. I thought it was going to be quick and simple. Didn't I say that when I first walked through the room?
you forget who you're dealing with?
I need to write this down because,
In big red
okay. The following labs indicate an abnormal response. We're talking about the body. The following labs indicate an abnormal response. Number 1. Oh, I think I have it here actually.
You said indicating abnormal?
Abnormal, not normal. An increase in CRP, which is the C-reactive protein, you got it. And when does that increase? When there is injury, when there is infection, or inflammation. Then we have a decrease in CD4. And do you think that T cells are going to increase or decrease? Increase. They have to increase to fight whatever is running. And then we're going to see increase in white blood cells. Right? Because white blood cells are fighting infection. So you have a test question that is select all that apply. Which ones you going to select? All. If they all are there. Right? All right. Let's go back. All right. We went through that. Okay. So let's go over the 4 stages of immune response. So the first one is recognition. Here we go. This is the body's ability to recognize or identify something that doesn't belong there. In other words, abnormal cells. So that means that the body is able to tell what is self and what is non-self. Something that belongs in the body and something that does not belong in the body. The next stage. This is where the body actually reacts by increasing and multiplying, whether it's white blood cells, whatever it is.
So like it's defense, anything, it's not
Correct.
just, yeah.
And then they respond. How the body responds. What is the body actually doing? The body's trying to kill whatever doesn't belong there. And then the last stage is very similar to the response stage. It's just continuing to kill whatever doesn't belong in the body and continue to increase the production of B and T cells. Body continues to increase B and T cells to kill whatever doesn't belong there.
What did you say for the, proliferation stage? I didn't get to write
Is
it.
somebody repeat it?
The body starts to defend.
Starts the what?
The defense.
So it
I guess.
increases and multiplies white blood cells and T cells.
First question. What do you think about A? You like A? Is the electrode that apply? So is A good or no? No, this is the entire process.
I would say yes.
How about B? How about C? No, it's, C is involved in all of them. How about D?
Yes.
And how about E? We didn't even cover that, so no. The answers are, once I get to my office, I will post the cover thing. You got my message, right, that I already recorded? Electrodes that apply. All right, how about A? Yes. B?
Yeah.
Yes, absolutely. How about C? Actually, wait a minute. No, B cannot be. Sorry. C? Antibodies are produced where?
In your bone marrow.
Okay, and what else is in there? There you go. So C is good or bad? How about D?
No.
There is not going to be questions like these on the test. You'll see. Okay, assessment of the immune system. What we need to look at too. What type of things we need to find out when we do an immune assessment. History of cancer, good, because that's going to compromise the immune system. How about medication? What medication the patient is taking? There are medications that affect the immune system in a negative way. Also, how the person is taking those medications. It could be that the patient is taking the medication inappropriately, right? Meaning the person maybe doesn't have money to pay for the copay, and the person is splitting the pill. So every day they have half of the pill instead of one. How about allergic reactions to different things? How about nutrition, right? If they're eating unhealthy diet, that would affect. How about alcohol? How about mental health? That affects the immune system. And any other disorder like hypertension, a whole bunch of stuff. So what do we need to do? Provide support and education to patients. We may have to talk to the person or find services for the person or send the person to a social worker so the social worker can find different things for the patient, housing, mental wealth, whatever it is that the person needs. Person may need a referral for mental health. All right? So what other things we need to, what other things we need to find out about the patient? talk about the meds that they're taking, the food that they're taking, how about the level of activity? We didn't talk about smoking either. Really, really important. What happens when somebody smokes? That actually affects the immune system. Sleeping? Yeah, absolutely. Anything else? Vaccine. Is that person up to date with their vaccination? Absolutely. Excellent. What's next? I know the selectors apply. Select all that apply. So these persons have what? Compromised immune system. That means the immune system is weak. So is the person going to have a lot of upper respiratory infections? Most likely. How about B?
Yes.
How about C?
We may not see.
So is it yes or no?
Yes.
Increased production of white blood cells.
Oh, they might already be what increase.
So if the person just have a cold, they can have an increase in white blood cells. Yes, they do. If the person is going to have a persistent low grade fever,
I didn't know it was any good.
you tell me.
Yes.
Yeah, absolutely. If somebody says something about the person that has HIV or cancer, they're going to have persistent low fever. How about you don't say onset of not sweat? Yes. Next question. Yep. You got it. I hope. No, but we didn't be in front of that we need to decide which one of all these tests are important in terms of assessing the immune system. Do we need to know about A, complete blood count, differential?
Yes.
Absolutely. How about B?
Yes.
So what's the reactive?
Oh, that's for inflammation, so no.
No, correct. C reactive is inflammation. We don't care about that right now. How about C? And D?
Well, that's also inflammatory, right?
Correct. Who usually will have a high anti-nuclear antibody in the rheumatoid arthritis, lupus, yeah. So we're gonna get rid of that one. And how about E, at E? So remember, we have hemoglobin, G, I, and E. So where are the answers?
A, C, and E.
Okay. All right. So we have two more diseases to cover, and then we're ready to go. So the disease has to do with what? Skin. So what normally happens is, it happens all over the body, but where it manifests the most will be in the trunk, hands, arms, and face. So the skin gets thicker, and it gets hotter. So, it affects the heart, the lungs, pretty much every single organ in the body. That means that the treatment will involve a number of things that most people would not need that many medications. About 90% of the population that have scleroderma are actually females. It usually happens between the age of 30 to 50, but we see it more and more now to the age of 60. anybody know what we put?
When, like,
So we have to do with the blood vessels.
yeah, they just, right?
So like in a way they lose their elasticity. And the only medication that works is calcium channel block. The other thing that works is person should not be going into cold environment. Because that's going to exacerbate the problem. And if the person, you can see it in the person's fingers, what color do you think the fingers are going to turn? Depending on the person's skin. It could turn blue, greenish, white, depending on the person's skin color. Okay? So what's the medication? Wonderful. Excellent. I love that. Okay. So, other treatments, we're going to use steroids, especially prednisone, to reduce and prevent inflammation. There are two other medications that we use, and they have been approved by the FDA. They're right here. Like I said, I already posted these online. The good thing with these two medications is that the two major side effects happen in both. And that would be changes in the stool color and bleeding. Okay? What are the two negative side effects? Could the changes in the stool color be an indication that the person has internal bleeding?
Yes.
Are you using these medications in conjunction with one another, or one
No,
or
it's
the
one
other?
or the other. But they both have been approved by the FDA. So only one of them. Okay? If one doesn't work, can we switch the person to the other one?
Yes.
Yes.
Sorry, this is between quick for scleroderma, but when you were talking about cough function and blocking bowel renal.
We're gonna spend a minute, yeah. You got it. Okay? Okay. All right. Why did the person need a EKG?
Yes, because blood.
It affects pretty much every organ. It affects the heart.
So is it gonna thicken the heart muscle too then?
Correct. What else do we need to know? Let's see. So, what do we need to, the person is going to be put into in one of two medications that perhaps is going to compromise the immune system. So what type of education, what type of support this person will need?
Infection
Huh?
Blood infection.
Infection prevention, hand washing, rinsing vegetables and fruits.
Staying away from sick people.
Correct, excellent.
Wash your hands.
What do you say back there?
I said wash your hands.
Yeah. Anything else?
Get your vaccines.
Up to date with the vaccine?
Isn't there some vaccines they can't, like, they can get
Live active.
right?
So which one are the live vaccines?
Live active flu, they don't do it anymore.
Hmm?
Oh, no, I have a
Can they get the MMR or not?
No.
So, I just want to remind you, about 30, 40 years ago, we told people they couldn't get this and that. For HIV patients, they couldn't get the, oh my God, the vaccine, now I don't remember the name. Anyway, there were certain vaccines that were live vaccines that we wouldn't give to patients that were HIV positive, and then we find out that they should have the medications. Because they were on medication, they could have the vaccine. So we're going to do this on a case-by-case basis because we don't know how strong that particular patient immune system is. So we assess the patient. We cannot say that every single person cannot have it. We assess the patient, we look at all the labs, and then the determination is made whether or not that person could have it. Okay? Really, really important because what we were doing, we were preventing some people from getting some vaccines that actually could be life-saving. Just because they're, let's go back to HIV, just because their CD4 was a 700. But that's a good number for a CD4, right? If it's not below 500 or below 200, they can get the vaccine, okay? Oh, it was a shingles vaccine that HIV patient did, okay? We're gonna do a good cardiovascular assessment that includes blood pressure. So we're gonna monitor the person's blood pressure. We're gonna educate the person about a healthy diet. That means that we're gonna reduce sugar, carbs, and what else? Fat, right? So that's really, really important. Which is in here anyway. So we are going to provide education not only about the disorder, but we're going to provide education about the treatment, the medication side effects. Because the person needs to be aware of what the side effects are, right? In order for them to take better care of themselves. We're going to provide mobility support. The patient may not be able to perform certain activities of daily living. I can't tell you which ones are going to be because individual, right? Each individual. So it's really, really important. There is one test of the exam about scleroderma. So you memorize what we just talked about, that is on the PowerPoint, and the dietary. What can the person have? What can the person not have, right? We talk about food. Decrease what? Fat, carb, sugar. We didn't talk about smoking. Stop smoking if the person smokes. Alcohol, I'm not going to say stop drinking. I'm going to say reduce the alcohol intake. Small steps. Not everybody can just say, I'm not going to drink anymore, and they stop. That's all I'm saying about that. All right. This is the last one, and then we have one or two questions. I can remember. But anyway, there is a much higher incidence in females than in males. Usually, females or people are diagnosed between the ages of 40 and 60. It can be diagnosed earlier than that. Who's going to pronounce it? We need 2 volunteers. The contest. Come on, somebody pronounce it for us. Look. Say it loud, please.
Sjogren's?
Okay. So, what are going to be the concerns for the patient? Joint pain is a big concern. What else? So, because the person, we hardly ever put people on bed rest anymore. Usually there's a few things like pregnancy. We're not going to go into that. And there's other times. Those people, we need the person to move. And even with somebody put on bed rest, that doesn't mean that the person is going to be now there, right? So we can do range of motion. Very good. We need the person to increase fluid intake. Person is going to need eye drops.
So they're just like extremely dry?
Yeah. These patients are going to be really dry, so we're going to increase fluid intake, eye drop, to lubricate their eyes. And what else do we need in the house? Especially in the summer. Humidifier, air conditioner.
Did you say they would or would not be on bed rest?
No, neither.
They are on bed rest, just range of motion.
Yes, but not once again. Depends on the person,
Okay.
right?
I'll just
Yeah.
Is that because of the synovial joint fluid inside? Is that
It
on?
hurts like
Okay.
crazy.
So it is, so with the, like, air conditioning, all that, is that because so,
Lower temperature, feel better.
yeah, and they're not
Comfortable.
able to sweat as much to lower the, am I?
So the person is really dry, right?
Yeah.
So everything in the body is dry, so we need that temperature lower. What happens when we have an increase in temperature?
Yeah.
Okay, what else do we need? No, I forgot. Oh, person is gonna have difficulty swallowing, so that means that the person is gonna have difficulty eating and speaking. All right. Now, we already said we're going to treat the eye with eye drops. What if the person has dry mouth? What can we give to the person besides water? But you can only drink certain amount of water. Yeah. Hard candy, chewing gum. For fatigue, the person needs to rest. What else? We're going to monitor swelling. And sometimes they may develop fever. So if they develop fever, what's going to happen? You can increase in temperature. They already dry. So what do we need to do? We need to give medication that's going to reduce that fever. What can we give the person? Give me 2 minutes. So acetaminophen. What else can we give? Ibuprofen, depending on what the person prefers. Okay? So I work with kids that always have pain, and I always walk around with acetaminophen, ibuprofen. And if I pull the ibuprofen out first, guarantee you, like 5 out of the 10 kids gonna say, oh, I don't take ibuprofen, I take acetaminophen. But I know the person takes ibuprofen, because I just look it up. So, has to do with behavior issues. So, with these patients too, what is your preference? Ibuprofen, acetaminophen? We're going to support the person. What type of support this person needs, or this patient needs? Emotional, absolutely. Anything else? Well, we got 3 minutes left.
Nutritional support maybe?
Absolutely.
Maybe like peach.
I like that every time you go to say something, you move.
I
like,
know.
speak it.
As soon as I'm right behind them.
All right. Stop smoking. Reduction in alcohol intake. Better diet. All right, what do you think of A? How about B? C? D? It's the other way around, right? And then E? All right. That's it? No, there's one more question. So, A, this is a real test. We run it to find out how much fluid the person has on their eye. So we actually use that test, so we need it. B, what do you think? At this point, we don't need a complete blood count. We already know what the patient has. What about C? You think so? Yeah, I like it. How about D? Yeah, it's skin biopsy is not what they're trying. And then the E, we need it because we need to assess how much saliva they produce. This is my last lecture. Otherwise, I could please you with the next one. I haven't done the recording for this. I will do it sometime this week, I will upload. And as usual, I send an email, I think it was one time I forgot. I will replace this well, not replace, add this PowerPoint when I get to my office after the test that I have to proctor, and, that's it. I'll do like, no, thank you. I'll do like little group tomorrow.